Thank Hello and welcome. Thank you for joining us this morning as we commemorate Illinois' 5th annual Trauma-Informed Awareness Day. I'm Bridget Gavigan. I'm the director of the Illinois ACEs Response Collaborative at Health and Medicine Policy Research Group. For over a decade now, we have collaborated with partners across the state and across sectors to put the issues of trauma and healing on the forefront of the equity agenda in Illinois. Trauma-Informed Awareness Day has become an annual opportunity for us to gather together to reflect on the progress we've made and to recommit to our purpose to keep moving this work forward in the state, to evolve over time, to keep learning together. Our theme this year is building a healing-centered future, solutions from the community. So we really want to challenge our imaginations to think about what it means to create equitable systems that foster well-being and good health from the outset. And we want to hear from you about what you're seeing in your community. So we're excited about the events that we have planned for the day. A couple of things just to note before we dive into the program. We invite you to introduce yourselves in the chat, share your name, your pronouns, your organization. If you have any questions or any tech issues, we ask that you use the Q&A function that you'll see at the bottom of the screen. Rather than the chat function, use the Q&A function so it doesn't get lost in the larger conversation. And we are recording this session, and we will share the link for the recordings as well as any slides and materials in a follow-up message. So let me jump into our agenda for the day. So excited to have Lieutenant Governor Juliana Stratton join us to provide a keynote address. Lieutenant Governor is a lifelong advocate for young people. She is a restorative justice practitioner. She is a trained Peace Circle keeper, and she brings a deep commitment to trauma-informed and healing-centered transformation. She leads the Justice, Equity, and Opportunity Initiative for the state, which is working to bring healing to the Illinois justice system. And she's leading efforts here in Illinois to address the root causes of trauma through strategic, coordinated approaches across sectors, systems, and communities. We are so thrilled to have you here with us today, Lieutenant Governor.
Well, good morning, everyone. I am Lieutenant Governor Juliana Stratton, and I use she, her pronouns. Thank you, Bridget, for that warm introduction, and for all you and your team at the Illinois ACEs Response Collaborative do to advocate and bring awareness so we can build a more trauma-informed Illinois. And on this Trauma-Informed Awareness Day, I also want to take just a moment to lift up Colleen Cacchetti and her family at this time. As many of you know, she recently lost her daughter to a tragic accident, and she is in all of our thoughts. And I ask that we send her all the love and all the strength as they memorialize Caitlin today. Today, we are having this conversation after what's really been years of mass trauma. And today, on the 3rd anniversary of his murder, I am thinking of George Floyd and the widespread pain of seeing his death caught on film, of seeing the trauma systemic racism inflicts on our communities. I speak the name of George Floyd, and because we are all committed to ensuring that we don't just experience sustained trauma and just keep going on with our regularly scheduled business as if nothing happened, I'd like to pause for just a moment of silence and grounding. Thank you. He should be alive today. And I think of the children and families in Uvalde, Texas, who this time last year had to experience the unimaginable, but frankly, too common trauma of mass shootings. Sadly, there have been so many since. Trauma on top of trauma. And we can't talk about trauma without also talking about the COVID-19 pandemic, the unprecedented grief and fear it caused, and the ripple effects of lockdowns and long COVID symptoms and isolation. You know, the saying goes that hurt people. And this is absolutely true. And there has been a lot of hurt, a lot of grief, a lot of pain. But we all know that it doesn't have to end there, because healed people heal people. To fully realize the brighter future we seek, we need to heal, and we need to get other people to be healed. And we all play our roles to uplift communities and provide the support for everyone to take the next step on this journey with us. So I want to take a moment to thank all those who stand with us to pave the way. And that includes members of the Trauma Informed Illinois Working Group, as well as the dedicated efforts of my friends and former colleagues in the General Assembly. And I want to thank you all for tuning in today, for joining us to listen and learn and further the conversation. As your Lieutenant Governor, it is an honor and privilege to do this work and to work alongside so many who bring their all, their passion and their expertise and their empathy to foster healing. In particular, I do want to shine a light on the team behind my office's Justice, Equity, and Opportunity Initiative, or JEO as we call it. JEO is a first of its kind initiative in Illinois to reshape our criminal legal system and transition away from punitive measures toward equitable, restorative, and inclusive practices. As a trained restorative justice practitioner, I've long been invested in repairing the harm that has been done by individuals one to another, the harm done by systems to communities, as well as the harm done by failed policies that have affected residents throughout this country for generations. JEO is working to do just that by tapping into the collaborations and partnerships that steward innovative ways to heal. That includes communities most impacted by this work, and people impacted by our criminal legal system are at the table with us, helping to lead the way. Over the past year, JEO collaborated with trauma-informed experts and stakeholders throughout the state to assess current trauma-informed and healing-centered efforts. An informal ad hoc working group was convened consisting of partners such as Illinois ACEs Response Collaborative, Illinois Justice Project, Center for Childhood Resilience, Illinois Childhood Trauma Coalition, the Illinois State Board of Education, as well as state legislators. And this group met monthly to share research and strategies and build upon the policy foundation established by prior initiatives, with the goal to promote statewide, broad-based, trauma-informed and healing-centered transformation for Illinoisans of every age. This is an exciting and hopeful era for our state. We continue to push the needle forward, and we're here today because we're driven to reimagine what is possible. We see the vision of a tomorrow that is based in true resilience, on communities not just surviving, but thriving with the tools they need for comfort, safety, and wellness. And that also means taking the big picture view of trauma, of the deep-seated inequities that touch so many areas of our lives and contribute to the pain and stress and fear. It's the major life-altering events like violence in our communities. It's also the daily barriers to resources and services that everyone needs and deserves. It also looks like not being able to access healthcare or struggling to put food on the table. Trauma looks like just getting by when someone is deprived of the security of knowing if they can make rent tomorrow or pay that bill or afford the commute to work or school. In all its forms, it requires that we act with urgency. Traveling across the state, I've heard stories of these traumas and just how deeply they have impacted the people of Illinois. Trauma looks like the experiences of a woman I met named Maria, who was impacted by the justice system, who said, I was in prison and then I went to prison. It looks like people who have been impacted by our criminal legal system, who have already served their time, feeling like they're still being punished because they can't access housing, healthcare, job assistance, the core elements to beginning a new chapter. The reality is that most system impacted people will return to their communities, whether or not they receive the necessary tools needed to help them navigate the reentry process. And for far too long, people leaving facilities faced insurmountable challenges to access one of the most important tools to a second chance, a state identification card. And that's why I'm proud that through the state ID program in collaboration with the JEO, people leaving IDOC facilities can have a state ID already in hand upon release. It's hard to underestimate how much that one piece of identification can not only change the course of someone's reentry, but can help with their healing of the trauma they've experienced. By ensuring people have a state ID, we're not just making the reentry process less challenging, we're reestablishing system impacted people's humanity. Really, we're building whole and healthy communities by seeing the entire person and their needs. The JEO initiative also worked with community partners and state agencies to launch the Healing Beyond Harm Restorative Justice pilot, giving survivors of crime an outlet to continue their journey of healing. We listened to crime survivors who told us that historically their needs have not been met by a justice system strictly focused on punishment. And we heard from incarcerated men and women who want to play a part in repairing the harm they've caused. Healing Beyond Harm creates a framework to do that through a facilitated harm dialogue process initiated by the survivor. As well as working to right the wrongs of the past, I'm focused on the work that we can do today to build a brighter tomorrow. As I said earlier, trauma comes in many forms, and it can touch us in varied, multi-layered ways. To show you the full scope we can take to becoming a healing-centered state, I want to tell you about Cairo, Illinois. Cairo is the southernmost city in Illinois. And for too long, its residents have experienced the trauma that comes with being deprived of the basic essentials to live and be well. Because of decades of disinvestment, Cairo has gone more than 7 years without a grocery store. And that means that families had to travel to Paducah, Kentucky to get food. And that's complicated by the fact that there's not one single gas station in Cairo either. My team and I heard directly from the people of Cairo about what it's like to navigate these challenges as part of my office's Agricultural Equity and Food Insecurity initiative called Ag Connects Us All. And this initiative is how we're cultivating an agriculture industry that is as diverse and vibrant as the state of Illinois, while also addressing food insecurity impacting communities across our state. As part of this initiative, my team and I traveled throughout Illinois to learn from stakeholders in our ag and food systems during an 8-month listening tour. And we made it a point to visit Cairo during our tour to ensure the community and its needs were seen and that they were at the table with us to build the groundwork for moving forward. Because it's the community that has the wisdom. They know the work that needs to be done, and we recognize the power and potential they have to make great change. As policymakers, it's up to us to support them and connect them to the resources that they need to reach higher heights, because that in and of itself is healing. Now, this truth continues to guide my office, and I'm excited to share that I'll be returning to Cairo next month to join stakeholders at the grand opening of the Rise Community Market, a cooperative grocery store run by the community and for the community. You see, our only way forward is together. And when we make space for everyone, especially our most vulnerable, to be heard, we open doors to something bigger and greater. As I close, I want to make it clear that there is more work to be done. Across the nation, we're seeing attempts to rewind the clock on progress. Knowing that other states are enacting cruel, regressive policies that strip away bodily autonomy, that restrict access to gender-affirming care and criminalize the LGBTQ plus community, that erase BIPOC voices from libraries and schools, that in and of itself is traumatic. In fact, the cruelty is often the point, attempting to make people feel less than or powerless through othering and oppression. Prioritizing trauma-informed and healing-centered efforts that uplift and bring empathy to policy is as important as ever. Illinois has remained a beacon of hope, and in the face of these attacks, we will not back down. In fact, we'll continue to champion comprehensive, holistic, and restorative approaches that help every community realize their greatness. Instead of restricting, we'll continue to expand opportunities that foster growth for all. Instead of silencing, we'll continue to amplify the voices of our most marginalized and disenfranchised so they can realize all that they are capable of. Instead of reliving the darkest parts of our past, we are committed to showing every Illinoisan that they belong in our future and that we will follow their lead to build it. Thank you so much for having me. I do also, as I often do, want to remind you of the importance of self-care. As I often say, you can't pour from an empty cup, and all of you pour out a lot. Please take the time to schedule maybe a few blocks on your schedule to get the rest that you need and deserve. Solutions from the community are only possible when we make space to rest and restore, and then come together with community, healthy and whole. Thank you again. And Bridget, I'll pass it back over to you for the next portion of the event.
Thank you so much, Lieutenant Governor. It's inspiring to hear you talk about this work, talk about the solutions and the creativity that you and your team are bringing to this. And, you know, really hearing community members and their expertise and their desires for their communities. I think about that Cairo example of the grocery store. They could have looked for a jewel or a traditional market to come in. They said, no, we can do this. We have an idea about what the vision is for our community. And, you know, the ability to provide them resources to make that a reality. Such a beautiful example. And I also appreciate you pointing to, you know, the societal implications of trauma, that it isn't just about individual experiences, that it is something that we go through collectively, that is informed by policy decisions, that is informed by culture, that it's informed by entrenched racism, that these are big, meaty issues, but there are many things that we can do about it. So thank you for sharing some solutions with us. Thank you for inspiring us this morning, and thank you for your leadership.
Thank you. Take care.
So our agenda for the rest of this session, so we're going to talk a little bit more about trauma and healing in Illinois. I want to share some bright spots that I've been seeing. I hope you guys will share some bright spots you're seeing as well. Share some ideas about where things might be headed in the state and what it might take to get where we want to be. And then we're going to turn the conversation over to you. We are going to use a online platform to help us ask questions of you, help hear your ideas, your thoughts and vision for the work that you see happening in your community and that you want to see happening in Illinois, and the types of support that you will need to make that happen. So before we dive into the session, I want to remind people of the activities that we have planned for the day. This afternoon, we're going to have sessions that feature interactive discussions where attendees can share their vision and ideas for solutions to build a healing-centered future. At 1 p.m., we will have concurrent sessions on health that I will facilitate, and on education that will be facilitated by Geeta Krishnaswamy, the Deputy Director of Health and Medicine Policy Research Group. You can still register and show up. We hope to see you there. And then this afternoon at 3 o'clock, our concurrent discussion sessions will focus on the criminal legal system, facilitated by Dr. Elena Quintana. Executive Director of the Institute on Policy, Safety, and Social Justice at Adler University, and focused on the community, facilitated by Marlita White, Director of the Office of Violence Prevention and Behavioral Health at the Chicago Department of Public Health. I also want to remind folks that our friends at Bright Promises Foundation are turning their social media over to their youth council today. So follow Bright Promises Foundation on their social media accounts. Follow the hashtag that you see on this slide to see specifically what their youth council are talking about. You're going to learn about racial trauma directly from young people themselves, and you can discover how you can take action to promote youth healing and resiliency. So I want to orient us around some, shared understanding of trauma and healing, and I invite you to share some of your ideas around that as well in the chat. As the Lieutenant Governor spoke to, trauma takes many forms. It can result from a wide range of events or set of circumstances that are experienced as physically or emotionally harmful or life-threatening. Trauma can result from individual experiences, so things like child abuse, bullying, intimate partner violence. It can result from community experiences, so experiences of racism and other forms of discrimination, community violence, poverty, a lack of educational or economic opportunities. And it can result from historic and contemporary collective experiences, so resulting from things like slavery and the systems built out of slavery, forced displacement, and mass incarceration. Trauma can profoundly shape our health and well-being. Without support, trauma can have lasting adverse effects on individuals' mental, physical, social, and emotional well-being. We know that people who have experienced trauma and do not receive any support are more likely to have health issues like cancer, diabetes, and heart disease. They are more likely to misuse drugs and alcohol, more likely to experience depression and anxiety, and more likely to be dealing with what researchers call social and productivity issues. So things like unemployment, less likely to finish high school or college. And trauma can be at the community level. It can impact our social cohesion, our sense of power, the feeling that there's anything that we can do to affect change in our communities. Trauma is common. Here in Illinois, 60% of adults report experiencing at least one potentially traumatic experience in childhood, with 16% experiencing 4 or more. As the number of adverse experiences and individual reports go up, so too do their risks for negative health and social outcomes. Trauma is shaped by our environments. So traumatic experiences do not have to happen in a vacuum. They are shaped by our conditions and environments around us. So poverty, economic housing, inequities, lack of access to healthcare, community violence. These are all sources of trauma that make people's environments a lot more precarious, increase the risk for individual and interpersonal traumas, and deprive people of the resources and supports to help them heal from trauma. Understanding how these conditions are built means examining the policies that have channeled resources into some communities while depriving others of the essentials needed for health and well-being. And that has to be done by addressing the historical and current collective trauma, like slavery, mass incarceration, forced displacement, and others that have led to inequities within our systems and policies and that continue to impact communities in the present day. And I want to close this piece by reiterating that our trauma does not define us. Our stories are complex and rich. We have passions and gifts and relationships and community bonds that provide a fuller picture of our humanity. When we talk about being trauma-informed, I like to explain that SAMHSA has developed the 4 R's of being a trauma-informed organization. So the Substance Abuse Mental Health Services Administration. So realizing the prevalence of trauma, knowing that ourselves, our coworkers, our communities, are potentially experiencing trauma and have been affected by trauma. Recognizing that people in our organizations and communities or systems are able to see the signs of trauma, responding by integrating an understanding of that experience of traumatic events into our policies and practices, and resisting re-traumatization. So being intentional about identifying any current policies, practices, and organizational culture that are harmful and collaborating with the community for change. We are increasingly talking about and using phrases around being healing centered in this work. So I want to honor Dr. Sean Ginwright, the founder of the Flourishing Agenda in Northern California, who developed a healing centered framework for youth serving organizations. And what Dr. Sean Ginwright says is that, quote, a healing centered approach is holistic, involving culture, spirituality, civic action, and collective healing. So it is not just viewing trauma as an individual, kind of isolated experience, but really that trauma and healing are experienced collectively. So I talked about how trauma doesn't happen in a vacuum. Healing and building well-being also don't happen in a vacuum. They come from participating in transforming the root causes of harm. They are asset-based, so thinking about what is right with us, what are our gifts and our interests and our passion and our ideas, what comes from our culture, and our relationships that are strengths. And they are community-driven. The decisions and solutions are made by the community. Looking here in Illinois, we can reflect on some of the progress that we've made in being trauma-informed and healing-centered. So we can see that there's growing awareness about trauma and its impact, and that cuts across multiple sectors that are engaged and involved in this work. Certainly education, early childhood, health and behavioral health, community-based organizations, violence prevention organizations, the criminal legal system, housing, aging services. They are, and increasingly, we're seeing businesses and civic organizations engaging with this work. And they have a number of strategies that they are looking at: training their workforce on trauma-informed policies and principles, implementing new policies themselves, so moving, for example, from punitive practices to restorative practices, developing programs to prevent trauma and promote healing. So there's a lot of bright spots for us across sectors. We are pushing ourselves to think beyond adverse childhood experiences. At least as initially conceived, the Adverse Childhood Experiences study in the late 90s, conducted by the CDC and Kaiser Permanente, was groundbreaking in driving our understanding of lifelong effects on our childhood experiences. It looked at 10 specific types of experiences that take place within a household. And it found those strong connections between those experiences and later in life health impacts. It was an opening of an examination of these health impacts of trauma. Research since then, like the Urban ACEs study out of Philadelphia, showed us that factors outside of those original 10 experiences, things like experiencing discrimination, interacting with the foster care system, that those are just as powerful of influencers on our health and well-being as those interpersonal household dynamics. And we see examinations of community trauma, collective and historical trauma, and systems-induced trauma that are also impacting us long-term. So this much, much more expansive understanding of the causes points us to wanting to address things at its root and points us to policy and systems change. We are thinking beyond childhood. While trauma that happens in childhood is particularly disruptive to our health and development, we know that trauma can happen at any age, and no matter when it happens in our lives, we will need support to heal. And we're thinking beyond treatment. We really want to push ourselves to invest in prevention, invest in some of those social determinants of health that the Lieutenant Governor mentioned, equitable housing, access to food, economic development, educational resources. there's emerging research on things like universal basic income and what that does to reduce trauma. So I just want to pick out a few concrete state level examples of bright spots that I've noticed. And I want to start with a statewide action plan to address childhood adversity that we developed alongside a diverse working group of folks from across the state representing different sectors and representing different communities. That action plan I'm going to talk a little bit more specifically about in a moment, but it really gave us a roadmap at the collaborative, and I think with some partners as well, about how we can focus our advocacy efforts and how we can focus our work as a sector and as a group of folks who are interested in trauma-informed transformation in Illinois. I want to point to the Whole Child Task Force that was established as part of the education reform package developed and championed by the Illinois Legislative Black Caucus. In March of last year, the Whole Child Task Force released a comprehensive set of recommendations focused primarily on trauma-informed, healing-centered policies and practices impacting schools and children. This session, just this week, the General Assembly passed legislation championed by Senator Lightford that would implement some of those recommendations from the task force. So it will seek to ensure that all schools are equipped with training and resources to meet the diverse trauma and mental health needs of their students. And it tasks the Illinois State Board of Education with creating a Children's Adversity Index, which would measure community childhood trauma exposure across the population of children 3 to 18 years old. The Illinois Children's Mental Health Transformation Initiative is another example of a bright spot. Governor Pritzker initiated this in March of 2022, led by Dana Weiner, who released a blueprint earlier this year outlining strategies for improving the state's response to young people experiencing mental health challenges, strategies that they are now pursuing solutions for. And I point to the REACH initiative, the Resilience Education to Advance Community Healing and statewide initiative out of ISB. Trains educators, school mental health professionals, and other community members to recognize the signs and symptoms of trauma and to address students' social, emotional, and mental health needs. REACH started as a pilot project in 2020, but ISB partnered with the Illinois Department of Public Health and the Center for Childhood Resilience to expand this initiative, seeing the great need of an increased need of trauma exacerbated by the COVID-19 pandemic. And then the last piece I'll highlight is something that we're still optimistic about for this session. We have been advocating for legislation to create a task force for a healing-centered Illinois. This task force would be led by the Lieutenant Governor, and it would have representatives from multiple state agencies, as well as community members who have been impacted by the systems that cause harm. This task force would come up with a set of recommendations and a strategic plan for the state to be coordinated, cohesive, and outcomes oriented in the work of being trauma-informed and healing-centered. So I want to ask for folks to think for a minute about what your bright spots are. What are you seeing in your work, in your communities, or your organizations that you would want to share as a bright spot? And you can put that right into the chat. We'll take a minute and then I'll call out a few. Please share your bright spots in the chat. Growing awareness. Thank you, Kelly. Hope and opportunity. Statewide expansion of early childhood mental health consultation. That is a bright spot. Kathleen Bush says they're creating their own strategic plan. Tracking state legislation. Wow, these are coming in fast. I'm so excited. We're going to save this chat. That'll be one of the things that we share out after this session is closed. Chicago Torture Justice Center. Yeah, Cynthia raises this idea that we're looking at trauma-informed care not only among mental health professionals, but across systems. That's exactly right. This is not just a mental health response. Calling out CDPH's mental health and violence prevention initiatives. Keep it coming, you all. Thank you. Restorative justice circle keeper training. Incorporating trauma-informed care into workforce development. Thank you all. Please keep the conversation going in the chat. I'd love to continue to capture those ideas. So as we think about, where we've been and what our bright spots have been, we want to think about where do we think we're going as a state? Where is this work moving towards? And, we talked about trauma-informed and we talked about healing-centered. And I think, where a lot of us are grappling with is how do we integrate these very, potentially complementary ways of thinking about this work? So integrate what we've learned about trauma and trauma-informed transformation with what we're learning about healing-centered frameworks, and imbuing our policy-making process itself with these trauma-informed and healing-centered principles. The Lieutenant Governor spoke to this, that how we develop and design our policies can often be harmful and traumatizing and can lead to poor outcomes because we're not engaging our community in a trauma-informed or healing-centered way. And of course, these community-driven solutions like the co-op that was developed in Cairo, that creativity and tapping into what the community's expertise is. And what will it take? So, we would like to see increased consensus building around how we're defining this work. What does it mean specifically to be trauma-informed and healing-centered as a state, as an organization, as a sector, as a community? What does it mean and who gets to decide that? Increased and improved coordination. We've got a lot of great work happening in specific sectors. What could we do if we were more coordinated in those efforts? Shared benchmarks, so having a common understanding of where we're headed and how we're tracking that, how we're measuring that, and alongside that, accountability. So, shared benchmarks so that we can see where we may need to push harder. Improved data collection and transparency. We hear this time and again. We don't always know exactly what the needs are in a community. We don't always know exactly what the assets are in a community. And community members often can't access the data that we do have in any way that makes sense or is transparent. So that really keeps people out of the decision-making process. And again, these are all issues that the Task Force for a Healing-Centered Illinois would address. We have one more step to go in the process with the General Assembly. It is on the Senate's calendar to take up, but it would be wonderful if folks could reach out to their senators and let them know that this is a priority, and we'll send some information as a follow-up to you all. And I just wanted to revisit a bright spot I mentioned earlier, which was the action plan to address childhood adversity in Illinois. And I mentioned that because the action plan that we co-created with people from across the state identified a number of priority areas that the state needed to address in order to be trauma-informed. So trauma-informed policymaking, improved state-level coordination, education and awareness, improved data collection and accessibility, and identifying trauma-informed practice metrics. So how do we know what we're doing is making any difference? And I bring this back because, this has been a strategic plan for us, and these are all items that we are seeing progress on, in particular, that the task force could likely drive forward in real ways. So another bright spot for us. So now I'm going to turn it over to you. We have an exciting new tool that we are using to engage large groups in discussion called AHA Slides. It works very similarly to things that you might be more familiar with, like Slido or Mentimeter. My colleague at the collaborative, Myra Diaz, is going to share the information for getting into this app, and we're going to ask you some questions and ask that you participate in this dialogue going forward. Thank you, Myra. So what you guys will do to join this conversation, be able to add your thoughts directly onto this screen so everyone can see it. You can use the QR code that you see through your phone to get to us, and you'll be able to respond on your phone. Or you can join through the link and use that code OKFMI. My colleague Hannah Chevron with the collaborative has dropped those instructions into the chat. So join through the QR code or through the link. I'll give you all a second to get in there. Oh, you're already jumping right in. What is one word that comes to mind when you think of healing-centered Illinois? I'll give you guys a few minutes. That's great. I see the word process in the chat. I wonder if, Hannah, if you have access or somebody else does, that they can add that in. Compassion, love, empathy, process, peace, hope, justice. This is beautiful. Thank you. I think people are still typing and joining on. If someone from the health and medicine team is able to add the words that are coming into the chat onto the slide, that would be great. Culturally responsive, kindness and acceptance. This is one of the things that I love so much about the framing of healing centered, is I think it really drives us towards a really beautiful way of framing what the responses can be. Flourishing. So I'd like to tranquility. Oh, tranquility just came into the chat. So I'd like to move on. Thank you for sharing this and seeing such optimism and hopefulness and love and care coming through in this slide. Myra, I think if we could move to the next question. So, oh, some people already have. Thinking about this from your own experience or role, what is one thing you need to advance trauma-informed healing-centered transformation in your organization or community? Collaboration with schools and teachers, awareness, communications, honest buy-in. That's such an interesting observation that you know, really people need to follow through on you know, their commitments. Dropping the stigma. I've been thinking a lot about this idea of stigma and what it would take to destigmatize the trauma and the need for, you know, supports when it does occur, and whose responsibility is that, and how does it look different for different communities? So again, when we think about community-driven and led conversations and decisions, what would community members say about the types of supports that they need? Are they reflective of what they're currently seeing in their community? And, you know, can we address, do we address, should we address the trauma that some of these systems have caused to communities that has created some of that stigma? listen to immigrant and LEP communities' needs. This is great. It's hard to track through all of this at once. So again, the great thing about this tool is that we will be able to download this, save these wonderful ideas and thoughts, and then share it out with the group. It will inform our advocacy work. It will inform the types of supports we provide. I'm still seeing ideas coming through here, but I do want to see if we can get to, well, actually, let's stick with it. We have some time. We can stick with this. Oh, somebody's mentioned they haven't heard anything about fathers. So maybe that's something that is an idea to bring in to this conversation. Training, deeper integration across disciplines. We hear this a lot. We hear this a lot from behavioral health staff who, often are, burdened or thought to be the only folks who have anything that they can do about this within their organizations. And really, this does fall to every single person within an organization, every single person within a community to figure out a role that they can play, and for us to support them in helping to figure out what that role is. So I think that this is one of the screens where we can then, is this one where we can, well, let's move on to the next question. What trauma-informed, healing-centered programs, policies, or strategies are you working on or seeing in your community that you wish everyone else knew about? And please make sure that you advance to the next slide so you can see the questions and put your responses onto the slide that says, what trauma-informed, healing-centered programs, policies, or strategies are you working on or seeing in your community that you wish everyone else knew about? Harm reduction strategies. TCI training, piloting guaranteed income work. I want to learn more about that from whoever put that into the slide. Beginning to explore trauma-informed approaches in philanthropy. I could talk for hours about trauma-informed philanthropy, and there are some great resources that we've seen coming out of some foundations, I think in Philadelphia. So I'd be happy to share those with anyone who's interested. Healing through justice. Integrating trauma-informed healing centered into the safety and security field. Meeting anger with kindness. In the chat, we have somebody sharing that architecture is a tool to make healing programming more efficient. See somebody's participating in the REACH program that we talked about. Oh, somebody created the first full online restorative justice high school homeschool network in the world. Please tell me more about that. Thank you. I see the chat about connecting about trauma-informed approaches to philanthropy. I would for sure follow up with you. Oh, coaching, education and athletically through trauma-informed lenses. How different would our sports look if they were coached through a trauma-informed lens? How many more people might participate? And we know participating in activities like sports is one of the protective factors that can help kids who do experience trauma serve as a buffer so that those traumatic experiences don't create lasting harm. Community resource days at local church, implementing sentencing mitigation to keep families together. This is amazing. Community resilience model skills training for organizations and individuals. That's a great model. Well, I look forward to sharing, going through all of these in detail and sharing this out with this full group. Creating trauma-informed parents, communities. Working on avoiding compassion fatigue, which we know is a huge challenge for the health and social service sectors and education sectors. Well, I'd love for you to keep those ideas coming. And I'd also wonder if we can move to the next question on this. Okay, take your time with this. If you could make, because here's what we're gonna do. We're gonna have you guys add your ideas, submit your ideas, and then we're gonna see, it's a big group, but we're gonna see if we can take some time for us then to go in and vote on the ones that we would prioritize. So if you could only, and be sure you scroll over to the next screen so you can see it. If you can make one policy change happen overnight that would make your community or sector more trauma-informed and healing-centered, what would it be? Mhm. Ooh, I'm seeing a theme with universal income, universal care, single payer. Requiring trauma-informed policies and training for professional development. Oh yeah, take out possession charges and punitive responses to substance use. Youth trauma and health for refugee and immigrants. This is really wonderful. Survivors of the war on drugs reparation payment. That is so brilliant and has me thinking about, what we've talked about with healing is that, if we're going to transform our systems, if we're going to be trauma-informed and healing-centered, it does mean that we have to reflect and repair harm that we've caused to individuals and communities through our systems and through our policies. Thank you for contributing that. I'm seeing a lot of universal equitable parent training. So that, every parent needs support. And it might look different for different parents or different communities, but, what is some universal process that we could have to provide support to parents? Oh my gosh, you guys, we're supposed to vote on these and I almost don't want to. They're all such good ideas. But we're certainly seeing themes emerge, and it will be really interesting to dive into this after the event in the next few days and start grouping some of these ideas together. I think we're going to see that there's a lot of commonality around some of the thoughts that we're bringing to the table here. Trauma-informed healing-centered competency training for all nonprofits. Yeah, we have to prepare our workforce. We have to give them the tools and the skills that they need to support themselves, to be supported by their organizations, and to create healthier environments for them and the folks that they're working with. Ending permanent punishments for people coming back from correctional facilities. I wonder if this is similar to what the Lieutenant Governor was talking about around, the challenge with reentry and the systems that you are intentionally cut out of, how hard it is to find housing, how difficult it can be to find employment. The new change so that you actually can have ID, which is a barrier. Lack of ID has been a barrier for folks to get the services and supports they need, to get housing that they need, to get jobs that they need. So I love that being in here. I'm going to give us 1 more minute to add ideas. I can still see them coming in. And then in our last few minutes, I'm going to invite everyone. You can start doing this already if you want to, but thinking about what you're seeing as the priorities that are coming through. There will be an opportunity to actually give a thumbs up to some of these ideas, and you can do that for more than one. Okay. I think I gave you a minute, so let's go on to voting. So you can see that the thumbs up icon that's in each of these boxes. If you like what you see, give it a thumbs up. You can vote for your own. You can vote for someone else's. Just curious to see where we land, and we'll give you 2 minutes for the voting process. So real quick gut reactions here. Yeah. All of them. I know. If you want, I don't know if you're allowed to vote for all of them, whoever just asked that, but you can certainly try. Okay. Someone asked, how do you vote? So if you're, in the app or on the, viewing it through the link, you see those little, each box has a little thumbs up at the bottom of it in the bottom right-hand corner. So you just click that to vote. All right, I think we're ready to see what the initial tally is, what comes to the top. Free and culturally responsive mental health services for every individual is our big winner. They're all winners. They are all winners, but it's so fascinating to see that come to the top. It's so important. More funding for early intervention and prevention, long-term, involved mental health professionals and police response are all, are big, tied for second here. Well, thank you so much for contributing in part of this process. It's just a snapshot of where our heads are today and where we're thinking about priorities. And I think what we will do coming out of this, and I think, Myra, we can probably stop sharing the screen at this point. Thank you so much. So what we're going to do is we are going to look at all those great ideas that you all shared, look at all of the supports that you said that you would like to see happen in your communities, look at all the great, wonderful things that you're already doing, and coalesce that, share that out with the group. I think especially when we talked about that one item that you would like to see happen, we saw a lot of common themes coming up, so it'll be really interesting to see how we can group those together and share that out with you all. I want to thank you all so much for joining us today for our Trauma Informed Awareness Day AM event. It was really wonderful to get the ideas and thoughts and wisdom from this group. And I hope to see all of you, many of you, at our afternoon sessions at 1 p.m. and at 3 p.m. Thank you so very much.